Thank you for joining here today. I represent the Pilsen Wellness Center. I work as a child and adolescent psychiatrist, and I've seen many children throughout my career. I'm glad that you're joining us today, and I just would like to share some thoughts about ADHD and the family. Some clinical characteristics of ADHD is that it's a combination of inattention, hyperactivity, and impulsivity. It begins in childhood before 7 years of age, and it persists on to adolescence 75% of the time, and adults about 50% of the time. And most functional impairment is across settings, so church, school, home, many different areas of dysfunction. And some people say, well, why are they overprescribing? Why is there so much ADHD? I think that's a very good question. I think there are a lot more studies need to be accomplished in order to find out all the possible etiologies. Sometimes it can be environmental and hereditary. The parents can have had it also, and it may be linked to a medical condition. So really, it takes a very good, skilled child and adolescent psychiatrist that's going to look at the medical aspects, the psychiatric aspects, and also the safety factors, because many of these kids who are hyperactive, have been hyperactive all their lives, can really be getting into a lot of injuries. Maybe they fall off the bike, they didn't see the stop sign, the car's coming, there's so many areas it can affect their driving as adolescents. Maybe they missed a signal or got distracted with something else. Maybe the cell phone. Of course, the world is distracted with the cell phone these days. But so there are many areas of dysfunction, and it really is based upon the diagnostic statistical manual that we as psychiatrists use in order to be able to diagnose ADHD or any other illness for that matter. So if you have a child like this, and developmentally 2-3 years of age is when hyperactivity is just the norm, because they're busy creating, busy learning about their world. But when you have a child that's had this from day one, and seems to be having great difficulty at school, academically failing, not doing well with their peers, getting into fights or arguments because they miss the cues of facial cues, that normally people who do focus pay attention to. Later on in life, this can cause problems in terms of moving from one job to another, not having real stability, or even in their relationships having many conflicts because there's some missed cues or facial cues. It's all part of the frontal lobe of the brain that is responsible for registration, concentration, and so there's a lot more to it than just a hyperactive child.